But maybe let's start with you, Premier, and then to the Minister, and then the Ambassador.
Yeah, I mean, I think it's just an update from since morning when we visited the scene. We've been able to round up all the hospitals that have admitted our patients. For instance, what we did as a provincial executive committee with the expo, we then had our MEC for social development, was at Siloam Hospital. She has just given us the report. She's satisfied with the conditions of the patients and that were there. We only, out of the total number of patients that were seen there, we lost one, a woman yesterday. She's one of those that give the number to 42. Because remember, on the scene it was 40. So amongst those who were admitted, we lost on the way, we lost one. And also Chirizini, the one that the child, 10-month-old baby, that we airlifted because she was severely injured. Unfortunately, we also lost her life yesterday. Now, Siloam Hospital, we went there. We are satisfied with the conditions of the patient. The one that was now critical, we have also transferred to Chirizini Hospital. We're here at Louis Trichard Hospital, where we are now left with, out of the 19 patients, we're left with 13. And the 13, the Minister together with the High Commissioner and the Ambassador have been able to have an opportunity to interact with some of the patients, especially the children. We are satisfied with the conditions. So up to so far we can appreciate, and I must thank the team from health, from EMS that responded, activating their chopper, because some lives would have been lost if we did not act swiftly. But out of the priority 1 patients, which were 8, we only lost 2. The 6 we've been able to save because some we transferred to our tertiary hospital in Polokwane. Now even the staff in our different hospitals were happy and satisfied because they are indeed treating this as an emergency, and the treatment they are giving the patient, it's something that I am proud of being a premier of a province. I'm also proud of the members of the security cluster from your traffic department that responded swiftly, from our police and also our forensic pathology, because the whole team has worked throughout the night for them to firstly retrieve and also attending to those who are sick, who are survivors, so that they get to the hospital. But secondly, to retrieve the remains of those that we have lost. They've done a good job. We've been able to retrieve the remains. We want to appreciate both the High Commissioner and the Ambassador having arrived with the Minister together with our Chairperson of Portfolio Committee, because by having them coming from the national sphere of government, you'll understand this is involving different countries. It's not about South Africans, when we can always easily look for your relatives for positive identification, because that is going to be a mammoth task to be able to now have to positively identify. Yes, postmortem will do them. By the end of the week, would have been done with the postmortem, but unfortunately, for us to issue and allow the remains, because we must issue certificates for the remains to be repatriated, they should be positively identified. So that is the work that is going to be a tough one, which we are going to work with our colleagues in the national sphere of government, but also together with those who are representative of both the Malawian and the Zimbabwean governments.
Let's allow the Minister now to say a few words.
Let me start off by saying that we did have an opportunity to visit 5 patients in the hospital, 2 adult patients, both of whom are conscious and were able to interact with us briefly. We also visited 3 babies and toddlers. It's a very difficult and tragic situation. 2 of the babies, their relatives are with them. One of the babies is as yet, we don't know hospital. And it's of course very, very painful when you see these tiny human beings who have been through this enormous trauma. I really want to take this opportunity to thank the Premier of Limpopo, the MECs, and in fact the whole healthcare system and emergency services system of Limpopo. You know, when you come into a terrible tragedy like this and you see a very organized system of recovery, a very organized system of making sure that all patients have been visited, have been accounted for, a very clear program in terms of dealing with post-mortems of the deceased, and also a program in terms of identification of survivors and deceased. It's really important. We don't feel in any way that these people have been neglected. So I really want to take this opportunity to thank the Premier and her team, and to pay my respects to all the professionals who have done a wonderful job in the face of a very, very difficult situation to save lives and to make sure that patients are now being properly treated. Thank you very much.
His Excellency Ambassador Maziripi from Zimbabwe.
Thank you. Indeed, it is very painful to see some of the victims of this tragic accident. I have been able to converse with 2 or 3 of them, and these are individuals who were planning on a journey to go home, and one of them was going home on holiday, and to meet such a fate, it's very painful even for us to listen to it. But I want also to join the Minister in thanking the Premier of this province and all the team that has attended to the scene of this tragic accident. We have seen and experienced the sympathy that they've shown, the professionalism that they've exercised in responding to this tragedy. And we want to really appreciate the support that you are giving. I want also to say here, my team from the consulate is present, and we are going to work hand in glove with the authorities here to ensure that we can identify the deceased and they can be repatriated to Zimbabwe for a decent burial that they deserve. Thank you very much.
Thank you, Excellency. Excellency, Ms. Ndau from Malawi.
Thank you very much. It's indeed quite an experience, and it's a sad situation to come and see some of the victims that are in the hospital, some very young babies. And I also had the opportunity to meet one of the Malawian victims. We were able to speak with him, and he was able again to narrate what was his experience in the bus. I think later on with the team that is here, we'll be able to find more information. He was traveling back home as well to receive medical care because he was not feeling well, and he was traveling with his wife. So what he was telling us was that I wonder where my wife is, but I'm just praying that maybe wherever she is, she's alive. So as the High Commission, as the Ambassador has alluded to, as Malawi as well, the team is going to be here to work hand in hand with the professionals that are here to make sure that the process of identification and the repatriation of the deceased is done in an orderly manner. So Premier and your team, let me also express my sincere gratitude for the good work that you have done with your team to make sure that the victims are treated with care, with sympathy, and with love. We thank you very much. Thank you.
Okay, thank you, ladies and gentlemen. I think we're going to stop here, unless if there are burning questions, but we have done a few one-on-one earlier. And thank you very much to all Premier, to the Minister, as well as to the Excellencies, the Ambassadors and the Commissioner. Thank you very much. What question is that doesn't wait for tomorrow?
Please. Askarama Fugori, News from Africa.
Yeah.
Premier and Minister, I just wanted to find out, from a logistical point of view, yes, there will be repatriation of the bodies. What other assistance would you be offering our neighbors from Zimbabwe and Malawi?
I think already what we can indicate to you, the first and important thing is to make sure that the survivors get health care, which we are doing. We're making sure that they receive that health care. Now, secondly, is the issue of those who have the deceased. We should be able to conduct postmortems, and that is the work that we can currently start to will resume on Wednesday with the team and with the MEC for health. You've seen it. We are also with the MEC for education and also MEC for transport and community safety. Through the collective team, it is also social development, and all these MECs with EXCO, our teams, whether it's social workers, whether psychologists, they're already on the scene in different hospitals to debrief the family. You have seen that there are family members who are moving, some were on the scene, some have gone to hospitals. They don't know what could have happened to their loved one. Some, they've already received confirmation. We are providing that debriefing, which is an important thing to do that you might underestimate, but it's something that requires qualified professional to do. We have done with that. Now, the issues that you're talking about of the repatriation, we'll be working collectively with the two governments. We've done it before as a province, and working with the two, as you have indicated, they've said they are bringing their teams here. Once the postmortems are done, positive identifications are done, then the process of repatriation will start. South African government, through the ministers, the Dept minister, Minister of Transport, and all of us, as delegated by President Ramaphosa, we will make sure that we assist the two sisterly governments to repatriate their loved ones.
All right, thank you. It was supposed to be a doorstep, 2 minutes. Yeah, go ahead, Makhado.
Thank you very much. Lesita Makhado for Departnent FM. Have you been able to identify the numbers from Malawi and those that were traveling to Zimbabwe, and those who were not necessarily on the register, on the passenger register? Were you able to figure out the numbers there?
We have not done that. If maybe I'm to assist here. We have not done that, as we have indicated to you that the important thing was to make sure that the survivors get health care. Now, the remains, we are able to retrieve them and store them, because it's important to store them within a certain hours. You know, with this heat, the body can easily be decomposed. So those were the important. Now, we will go to the second step of positive identification. It is only that process of positive identification that will be able to assist. We will put up a center in this particular municipality wherein the families can call in, and those that have lost, they don't know whether their loved one was in the bus or not, to be able to deal with those. All those logistics, as time goes on, you will be correctly updated either by one of the MECs, either health or MEC for transport and community safety.
Okay, thank you. Let's take the last two, yourself and then the gentleman here. Who are you?
Afternoon, Premier. To Makhado from News 24.
Okay.
Mine is very simple, Premier. Why did you overload it, heavily overload bus, travel uninterrupted in your province? Where were officers to prevent this from happening?
I think we've already clarified that issue is the subject of the investigation. And I think we've already explained at the site that when we have full details with regard to the journey of the bus and who visited the bus in the course of its journey, then we will speak to you about that.
Yeah, last gentleman here. Introduce yourself.
My name is Bernard Chiguari from Daily Mavericks and Limpopo Mirror newspaper. Premier, do we have any other patients who have been discharged? If so, can we hear from the ambassadors what help are they going to give to those people who have been discharged?
I think maybe yes, we have discharged certain patients, and like I said to you, we're working with two governments. The ambassador and the high commissioner are here. The reassurance that we got is that they are with their teams. Their consular generals are here. They are going to remain here and be able to assist us to make sure that those who are discharged are able to go home.
I think it's important to explain that we've already, together with the Premier's office, set up a group that comprises the provincial government, representation from Dept, our own road traffic management team, as well as teams from the two embassies. And it's that team that will be working together to take the process forward. And obviously, you can see that we've been working closely together on this visit, and we will continue to work closely together until all matters are done.
Thank you. If I may also just add a word, clearly we need to identify the victims, whether they are alive or they are deceased. And once we have identified and positively confirmed that these are Zimbabwean nationals, certainly the government of Zimbabwe is going to give them support, assistance in terms of repatriation back to Zimbabwe. And that is why my consular team is going to be on the ground until we can account for each and every one of the Zimbabweans who has been involved in this tragic accident. Thank you.
Thank you.
Yes, gentlemen, ladies, they say, did our defeat, so